In China, treating illnesses through auricular diagnosis and auricular acupuncture has 2,000 years of history. More recently, over the past 30 years, auricular diagnosis and therapy has become a unique branch of Chinese acupuncture. The World Health Organization has categorized it under the microacupuncture system. It is also regarded as auricular science. Diagnosis and treatment of auricular points. How can the ear's auricle reflect the disorders of the whole human body? In the spiritual pivot, there is a statement. Inspecting the condition of the ear, one knows the nature of disorders. Modern medical research has shown that the auricle does indeed tell information about the whole body. When one falls ill, the relevant ear points will show a series of positive reactions. Auricular diagnosis is based on these signs. Inspection. This is a diagnostic method done by directly observing the patient's ear. The doctor looks evenly at the patient's ear. Meanwhile, he holds the patient's auricle between his fingers and looks for positive reactions from the auricle's central to peripheral area and from the superior to the inferior area of the ear's surface structure. Once a reaction has been detected, the doctor uses his or her middle finger to push that part of the ear from the back, and then observes carefully the type and location of the reaction. He or she also needs to check corresponding points on the other ear for comparison. Discoloration. Redness indicates an acute disorder, pain, or an acute attack of chronic disease, such as dizziness or ulceration of the duodenum. Whiteness indicates chronic or organic diseases. Morphological. Nodule-like protrusions indicate headache. Catenoid bead-type protrusions indicate lower back pain and cervical spondylopathy. Flake-shaped protrusions indicate cholecystitis and superficial gastritis. Depression in the shape of a little dot indicates astigmatism. If the dot-shaped depression is accompanied by a flake-shaped protrusion, it may indicate myopia as well as astigmatism. A flake-shaped depression indicates hypotension, diarrhea, or tooth loss. Subcutaneous edema in the ear often indicates coronary heart disease, abdominal distension, edema, diabetes, etc. Papula. They are often found in cases of bronchitis, arrhythmia, dermatological diseases, etc. Scaling. This often indicates dermatological diseases, seborrhea, hyperlipemia, etc. Hyperemia. There are sectional congestion and radial congestion. Either of them indicate arthritis. Prior to inspecting the auricle, the doctor should not wash or rub the auricle in order to avoid causing blood perfusion or affecting the normal reaction. Palpation. The touching method is to press a point with a detecting stick to find tender spots and morphological changes, to touch the auricle with a finger pad to find structural changes, or to use a detecting pen to look for a positive reaction spot. Palpitometry. This is done by exerting an even pressure on the ear point to compare a variety of points in order to detect the most sensitive or tender point. They usually indicate an acute illness, a pain syndrome, or a tumor. Pressed mark. This is a method done by using a detecting pen to press along points and to try to determine the disease by observing the way the dent looks after the pressure is released. Pressing marks that are deep, white, and disappear slowly are associated with deficient patterns and generally indicate chronic diseases. Pressing marks that are shallow, red, and disappear rapidly are connected with excess patterns and indicate acute diseases. Finger feeling. This is a method of detecting morphological changes through the palpitation of the finger pad, often used to diagnose chronic diseases. If the cartilage around the occipital area on the ear feels thick to the touch, it suggests neurasthenia and having difficulty in falling asleep. If, on the other hand, the cartilage at the back of the ear, which corresponds to the occipital region, feels hypoplastic, it suggests dream-disturbed sleep. Detecting. If there is a swelling or ripple-like crease at the heart region, it suggests arrhythmia. If a cord or flake-like protrusion is detected in the middle of the heart area, it suggests coronary heart disease. Electroexploratory. The electric resistance detection method detects a person's disease by using an apparatus which will generate signals in the form of sound, light, and electricity according to the electrical changes at different points on the ear. Altogether, there are 3 types of reaction: weak, moderate, and strong. A mild sound that comes slowly and with a slow tone suggests a weak reaction. A rapid, strong sound with a low tone suggests a moderate reaction. It indicates that the point is a reactive spot of disease. A rapid, strong sound with changed pitch indicates that the point is the main location of a disease. Common methods include spot pressing and the linear movement detection method. The sequence of detection. Triangular fossa. Check Shunnam and the superior triangle for blood pressure problems. Apply the linear movement method in the middle of the triangular fossa to detect the condition of the pelvic cavity and for internal genitalia disorders. Superior concha. For disorders in the urinary system, check the points of the kidney, ureter, bladder, urethra, external genitalia, and anus. For pancreatitis, diabetes, and disorders in the liver and gallbladder systems, check the points of the pancreas, gallbladder, and liver of the left ear. For digestive system disorders such as constipation, diarrhea, tumor, etc., check the points of the mouth, esophagus, stomach orifice, stomach duodenum, small intestine, appendix, large intestine, and rectum. The right ear is used to detect disorders in the stomach, duodenum, and appendix. The left ear is used to detect constipation, diarrhea, tumor, etc. in the small and large intestines. The inferior concha. Points include the heart, trachea, and lung. Check the spleen and heart points on the left ear, mainly to detect corresponding diseases. Tragus. On the external side, tragic apex, adrenal, and the external nose points can be checked. On the interior side, pharynx, larynx, and the internal nose points can be checked. Intertragic notch. Check for internal secretions I1 and I2. Antitragus. On the external side, check the forehead, temple, occiput points. Middle border, the antitragic apex. On the internal side, the subcutaneous points. The earlobe, tooth, tongue, jaw, anterior of the lobe, eye, interior ear, tonsils, and cheek can be checked. The superior antihelix crus. Check the toe, heel, ankle, knee, and hip. Inferior antihelix crus. Check the buttocks, sciatic nerve, and sympathetic nerve. The antihelix. On the external side, check the lumbar vertebra, thoracic vertebra, and cervical vertebra. On the internal side, check the abdomen, chest, and neck. The scaphoid fossa. Check the fingers, wrist, elbow, shoulder, and clavicle. Precautions when using the cutaneous electric resistance method. Do not clean the auricle with alcohol and cotton prior to checking, or rub the ear forcefully, lest vasodilation cause alteration of the electrical resistance, increase the conductivity, and induce false reactions. People tend to sweat in summer and feel cold in winter. Therefore, ask the patient to rest a while before doing the detection. In case there is no response, use a saline or cotton ball to wipe the electrode to increase the sensitivity, and thereafter resume the detection procedure. During detection, due to the helical structure of the ear, pay attention to the directionality of the ear points. Carefully distinguish the physiologically sensitive points from the pathologically sensitive points. Differentiation of syndromes. Based on the fundamental theory of meridians and the Zangfu organs in Chinese medicine, along with the knowledge of modern medicine and clinical experience, differentiation of syndromes is a process of detecting and analyzing the reactions obtained through touch and detection of decreased cutaneous electrical resistance. Analysis according to corresponding area. If a nodular protrusion is found at the anus point, this suggests hemorrhoids. If a cord is felt at the inside or outside of the lower border of the antihelix, it denotes hyperosteogeny of the third and fourth cervical vertebra. If cords are at the middle portion of the cervical vertebra at the beginning of the helix, this suggests fourth and fifth cervical hyperosteogeny. When a cord is at the lateral border of the upper portion of the cervical vertebra, there may be sixth and seventh cervical vertebra hyperosteogeny. Hyperosteogeny of the lumbar vertebra is indicated by catenoid bead protrusions. Analysis according to the theories of traditional Chinese medicine. When one suffers from bronchitis or asthma, the lung area and trachea points are indicated. Because of the internal-external relationship of the lung and large intestine, reactions may be detected in both areas in asthmatic conditions. If there is disharmony between the liver and spleen, a pressure mark will appear at the midpoint of the superior concha. Analysis according to the theories of modern medicine. For peptic ulcers, millet-sized nodules can be felt at the stomach and duodenum points at the back of the auricle. Meanwhile, there will be positive reactions on subcutaneous points. According to Chinese medical theory, internal organs are related to the cutaneous region. When one suffers from diabetes, there will be a positive reaction at the pancreas point of the left ear, as well as edema. This is due to insufficient secretion of beta cell insulin from the islets of the pancreas. Analysis according to the functions of the auricular pulvaris. Generally, every ear point can reveal a disorder. For instance, when there is a reaction at Fengqi point, the patient may suffer allergic problems. If there is a reaction at Tingzhong point, at the middle of the superior concha, edema is indicated. The sign of an auricle fold can be used to diagnose tooth loss, tinnitus, coronary heart disease, arrhythmia, and hypotension. Analysis according to the clinical experience. If one has a benign tumor, the corresponding area will show a soft nodule or protrusion. For malignant tumors, such as esophageal cancer, there will be a protruded nodule on the corresponding points, which may be hard and immobile. The incision of a surgical operation will leave a line in the shape of a crescent moon on the corresponding ear point. Auricular diagnostics, developed through years of clinical experience, will in the future have greater and greater use. Auricular therapy acts to dredge the meridians and collaterals, regulating the flow of qi and blood circulation, and strengthening the body's resistance by increasing body immunity. The therapy is said to be the bright pearl of Chinese medicine. The filiform needling. Detection and disinfection of points. First, make a clear diagnosis and detect the points accurately to ensure proper puncturing. Cleanse the ear with 75% alcohol solution. Particularly be aware of the triangular fossa, superior concha, inferior concha, and the auricle opening. Posture of the patient, insertion of the needle. Have the patient in a sitting position. The practitioner inserts the needle by twirling 180 degrees. This is called the twirling insertion method. Angle and depth of insertion. A proper insertion depth means that the needle penetrates through the cartilage but not through the back of the ear. The direction of insertion is perpendicular for such points as the heart, lung, and sanjiao on the concha. Insert the needle obliquely on the helix crus. On the antihelix, insert the needle at a 45-degree angle. Points on the earlobe and scaphoid fossa are inserted transversely to form a 15-degree angle. Needle manipulations and strength. Twisting method. When a needle is inserted, twist the needle in a small amplitude for a few minutes to exert a mild stimulation to the point. This is indicated for chronic diseases. Lift and thrust method. After the needle is inserted, lift and thrust the needle with force for a few seconds. A strong stimulation to the points has a dispersing effect which is suitable for acute disease and pain syndromes. Simple insertion. A needle is inserted into a sensitive spot without manipulation. A mild stimulation has a tonifying effect, which is appropriate for aged, children, and chronic conditions or weak constitutions. Withdrawing the needle. Withdraw the needle by twirling it out of the point. If the needle hole is bleeding, wipe away the blood with sterilized dry cotton. Treatment is applied every day or every other day. A course of treatment lasts from 5 to 7 sessions. Ear pressing therapy. Auricular plaster therapy is one of the most effective methods at present. It is applied with seeds taped to the auricular points. The seeds may be herbal seeds or medicinal pills which are hard and with a smooth surface. As one of the most effective methods in treating diseases, this therapy is safe and free of side effects for extensive indications, thereby welcomed by patients. Commonly used seeds include Semen Vaccaria, magnetic beads, 急性子, 黄金子, 人丹, 气通丸, and 六山丸. Other materials needed are a seed holding plate, auricular point detector, detecting stick, homeostatic forceps, needles, alcohol, cotton, and dry sterilized cotton. Techniques of pressing. 3 stages of auricular therapy. 1. Inspect auricular points to find sensitive spots. 2. Disinfection of the auricle. 3. Place the seed onto an adhesive tape and put on the points. Pressing manipulation. When the seed is taped to a point, press the seed with a slight force to produce a feverish, distending, or radiating sensation. Moderate stimulation should be applied. For children, pregnant women, and aged, press the seed gently. For acute, painful, heat, and excess syndromes, apply strong stimulation. For neurasthenia, tape the seed at the occipital area on both the anterior and posterior sides of the ear. Pressing direction. For points around the helix crus, such as the large intestine, duodenum, seed should be directed towards the helix crus. For the heart and lung points at the inferior concha, tape the seed vertically. For the kidney and ureter points, tape the seed towards the inferior border of the helix crus. During the course of therapy, ask the patient to self-press each seed 2 or 3 times a day, a minute or so each time. This will increase the point stimulation. The patient should come in every 5 or 6 days for treatment, and 5 visits make 1 course of treatment. Massage methods of auricular points. Auricular massage is an external method for prevention and treatment of diseases. It has the effect of promoting qi and blood circulation in the meridians and collaterals, regulating the functions of jiangfu organs, strengthening the spleen and stomach, tonifying the kidney, and sharpening the hearing. Lateral surface massage. First, rub the palms of the hands together to warm them. Next, massage the anterior side of the auricle with the Liaoning point in the palm center directed towards the ear. Follow this by folding the ear to massage the back of the ear. Do this 3 to 5 times with the purpose of preventing and treating disorders of meridians and jiangfu organs. Cranial surface massage. Massage the auricle's back with the index and middle fingers, starting from the top part and then going downwards 3 to 5 times. This is indicated for pain of jiangfu organs, neck, lumbar, back, and joint pain. Helix massage. Pinch the helix with the thumb and index finger from the top to bottom 3 to 5 times for frequent, urgent, and painful urination, hemorrhoids, constipation, diarrhea, headache, and dizziness. Lobus auricular massage. Place the index finger of both hands on the outside of the tragus. Pull the antitragus and earlobe from the inside to the outside. This method is also called two phoenixes spreading their wings. The method is good for brain function, improvement of complexion, prevention and treatment of headache, dizziness and vertigo, neurasthenia, common cold, tinnitus, and ophthalmic diseases. Whole auricular massage. Massage with the index finger from the triangular fossa to the superior conchal cimbia conchae and inferior conchal cavum conchae. Then add the thumb to massage the antitragus and earlobe. Next, use the index finger along the antihelix, inferior and superior antihelix crus, and the helix crus. Massage all the points a number of times. This is referred to as reinforcing the city wall to enrich the kidney qi and prevent deafness. Embedding needle. Embedding intradermal needles at auricular points is indicated for chronic diseases, for patients with very weak constitutions, for those unable to receive treatment daily, or for enhancement of therapeutic effects for those whose conditions are just cured. Treatment may be given to both ears or one ear at a time, with 2 to 3 points embedded with needles each time. The needles are retained in the ear for 3 days. Galvano acupuncture. Electric acupuncture is a method which combines the conventional filiform needle and the electrical impulse stimulation. It is often applied for nervous system disorders, asthma, and visceral pain caused by spasms. Drugs, injection. This method is conducted by injecting a little amount of non-irritating medicinal liquid into some points for prevention and treatment of diseases. If local anesthetic is injected into the auricle, it is also called auricular point blockage. Laser. Laser radiation to auricular points is used to replace the mechanical methods for stimulative and thermal effects. It is often applied for stomatitis, rhinitis, and pharyngitis. Pressing magnetic probe. By taping magnets to the auricle, the magnetic line of force penetrates the points to regulate functions and treat diseases of the body. The magnetic beads, or small pieces of magnet, are taped to the auricle or worn as an ear ornament for head and facial disorders. Bleeding. Auricular bleeding is applied by puncturing an ear point with a needle to treat heat syndrome, inflammation, hypertension, headache, dizziness, ophthalmic, and dermatological disorders. Common points to be bled include ear apex, tragic apex, adrenal, liver young, helix 1 to 6, the groove and lung area on the back of the auricle. Prior to bleeding, massage the ear to cause blood perfusion. Thoroughly disinfect the point to be bled and puncture 1 to 3 millimeters in depth. Allow 3 to 5 drops of blood. Then press the point with dry cotton to stop further bleeding. This is done daily or every other day. Earring. This method treats disease through impulse electric stimulation discharged from the damp to the ear. A pair of clamps is used on one or both ears. It is good for treating lumbar and lower lumbar pain, shoulder joint pain, cervical spondylitis, headache, trigeminal neuralgia, cholelithiasis, etc. Plum blossom acupuncture. The auricle can be tapped with a plum blossom needle or pricked with a filiform needle to let blood. It is suitable for neuroparalysis and dermatological diseases. Massage both ears for a few seconds to cause slight perfusion. Apply antiseptic to the auricle. Then tap the relevant point or area with a plum blossom needle. Prick with a filiform needle or gauge 4.5 millimeter injection needle as quickly as a sparrow pecks until the skin bleeds. After bleeding, first wipe the ear with sterilized dry cotton. Then follow by using alcohol cotton. Pattern of auricular points. An auricular mold is made in accordance with the shape of the auricle. There are holes in the mold where some stimulative substance is filled in for therapeutic purpose. This is very convenient to apply. Principles for selection of point. Selection of points is an important procedure in applying auricular treatment. First, obtain the clinical information on auricular reactions through inspection, touching, and sound detection. Analyze the information and differentiation of syndromes in accordance with the theories of Zheng for organs, meridians, and collaterals of Chinese medicine as well as that of modern medicine. Then work out a formula. Selection of points according to the disease location. The primary points to be selected are those reactive spots which confirm the affected areas of the body. Whether one chooses the corresponding points accurately or not directly affects the results. First, inspect and detect the auricular points relating to the problem. For instance, with cervical spondylosis, select the cord spot touched at the cervical vertebral point and the kidney point. If numbness of the fingers accompanies the problem, select the fingers point. For pain, select Shenmen and subcortex to invigorate the blood circulation. Taping a seed at the cervical vertebra point, both on the front and back of the auricle, may enhance the therapeutic effect. Selection of points according to the theories of traditional Chinese medicine. Desquamation may occur in the large intestine and the lung areas of the auricle when one suffers from dermatological diseases like cutaneous pruritus. To treat dermatological diseases, bleed the ear apex. This may cool the blood, eliminate wind, promote sedation, and relieve itching. Usually, 2 to 3 drops of blood are bled. Seeds are taped to the lung, large intestine, Shenmen, Fengxi, endocrine, adrenal, and occiput points. Selection of points according to the theories of modern medicine. For duodenal ulceration, a reaction appears at the duodenum point. Touching the corresponding point on the back of the auricle, one can find a millet-sized nodule. This conforms with the theory of the relationship between the viscera and the cortex. The causative factor of the disease is improper food intake and excessive nervous tension that leads to the functional disturbance of the vegetative nerves. Points selected for treatment are the sympathetic nerve, Shenmen, duodenum, spleen, and subcortex points. Selection of points according to the functions of the auricular points. Based on the theory of traditional Chinese medicine, the ear apex has the properties of reducing temperature and blood pressure, anti-inflammation, sedation, anti-allergy, clearing the mind and sharpening the vision. Indications include pain, inflammation, and excess syndromes such as hypertension, headache, insomnia, poor memory, fever, ophthalmic, allergic, and dermatological diseases. In cases of dizziness, select Shenmen, temple, occiput, heart, and subcortex points. Selection of points according to the clinical experience. Auricular points have the property of promoting the circulation of qi and blood in the meridians and collaterals, regulating qi and blood, balancing yin and yang. Clinical experience shows that for treatment of angioneurotic migraine, selecting the external genitalia point will achieve a very good result. Other points often included for treating migraine headache are Shenmen, gallbladder, subcortex, and temple. External genitalia. Treatment of diseases. Bronchitis. Auricular plaster therapy for bronchitis has satisfactory results. Phytohemagglutinin skin test and reset formation test show increment of SIGA in the sputum, which indicates that auricular plaster therapy for bronchitis can strengthen the body's cell immunity. Points selected are fengxi, sympathetic nerve, lung, trachea, and Yenzhong points. Clinical observation shows the therapeutic result for simple bronchitis is more effective than that of asthmatic bronchitis. Cosmetic. Cloasma may seriously affect one's facial appearance. Causative factors may be increased levels of progesterone, estrogen, and melanin-stimulating hormone, or increased level of serum copper in the case of pregnant women. Points selected for treatment: internal genitalia, kidney, lung, adrenal, subcortex, and Yenzhong. In addition, the cheek area on the auricle's back can also be taped with a seed. While on the anterior side, use the sparrow pecking method to let blood on the superficial epidermis only. Neurasthenia. A common disorder of the nervous system, neurasthenia is very often due to prolonged overthinking and mental strain and stress, or possibly due to the weakness resulting from illness. First, bleed the ear apex in order to sedate the patient, reduce the blood pressure, and promote a clear mind and vision. The amount of bleeding varies depending on each individual situation. Points taped with seeds are shenmen, kidney, heart, subcortex, occiput, and a second occiput. To further enhance the therapeutic effect, tape a second seed on the back of the auricle to the corresponding occiput area. Weight loss. The principle of treatment for weight loss is to regulate the endocrine in order to increase the organ's function, reduce appetite, increase the full sensation of the stomach, and to promote defecation. Points selected are internal genitalia, kidney, large intestine, sanjiao, endocrine, Yenzhong, abdomen, and forehead. Vascular hypertension. Auricular plastotherapy has a certain therapeutic effect for hypertension. Observation of ballistrocardiogram before and after the treatment has shown a tendency for the wave to be lower before treatment and then higher after treatment. By stimulating the superior triangular fossa on hypertensive patients, a change of the wave of vasoconstriction is observed. Other reactions occur if nonspecific points are stimulated. Points selected for hypertension treatment are heart, subcortex, 眼中, spleen, occiput, superior of triangular fossa, and external ear. Auricular therapy, being a new and unique science, combining therapy with diagnostic methods, has gradually developed into an independent theoretical system. It will make great contributions and have a deep impact on the world of medicine.
一路漫漫，披荆相伴，